Welcome back, everyone. And again, hope you enjoyed some cookies I heard are over there. Hopefully there might be one or two left. And had an opportunity to check out these fantastic student posters. While they are all impressive, if you had a chance to look at them all, we did have to narrow it down to just one, and we'll be announcing the winner here very, very shortly, so stay tuned. Now we're going to move on to one of my favorite conversations, and is often a bit of a fundamental conversation before we even get into technology or the specific technology that we're utilizing. It's how do we ensure that our workforce has the digital health literacy to utilize that technology in a way that benefits our healthcare system to the most potential, and how do we build that capacity within our healthcare system? And so I am pleased to introduce, or I'm going to say their name and let them introduce themselves. I've got a fantastic panel of experts in both the academia and research worlds. Right beside me here is Calvin Coe, sorry. Next to him on his left is Elizabeth Borycki. We've got Glynda Rees, and then we have, Claudia Lai, isn't it? I knew I was going to get it wrong. I'm so sorry. So I'll just let them introduce themselves quickly, and then we'll get into the first questions. So Calvin, for yourself.
Yeah, hi everyone, glad to be here. So my name is Calvin Koo. I'm an assistant professor in the School of Biomedical Engineering at the University of British Columbia. I am also a researcher at the Center for Aging Smart out at VGH. And the main thing that I'm here to kind of talk about in education. So we also run a couple of specialized graduate programs in our department and at the school revolved around Care Anywhere, this idea of remote technologies in healthcare, and Engineers in Scrubs, the idea of embedding engineers in clinical settings to better understand what the needs are. So thank you.
Hi, my name is Elizabeth Borycki, and I'm a professor in the School of Health Information Science at the University of Victoria. We also have a number of programs. We have an undergraduate degree in health informatics, a combined program with computer science, so a degree leading to a health information science and computer science undergrad. We have several graduate programs, one on campus, one online, leading to MSCs in health informatics, as well as a double degree program with nursing and health informatics. So you get 2 degrees. So you can be a clinical expert in 2 different areas. And lastly, a PhD program. We also have some sort of certificate programs around terminology and interoperability.
Thanks. Hi, everyone. I'm Glynda Rees. I am the program lead for the new Digital Health Advanced Certificate here at BCIT. I'm a nurse, and I am really happy to be sharing this program with you. We have some of our students here today from the program, and really our intent is to build digital care capacity within the healthcare workforce, and I'm really looking forward to the conversation today.
Hi, my name is Claudia Lai. I am an assistant professor also at the University of Victoria in the Health Information Sciences Department. I'm really excited to be here today. I'm here in the panel, I guess, to share with you my research area where I deal with patient partners. I'm interested in looking at digital tools to help them make better decisions as they live and age at home.
Well, thank you. So to set the tone for this conversation, we just wanted to give a bit of a case scenario to let you understand. Many of you probably already know this, but just to set the tone of what we're trying to build capacity to be able to do. So thinking about a particular patient, in this case, a patient named Grace. Grace is 65 years old. She's receiving home health care for her long-term chronic obstructive pulmonary disease, or COPD. Lives with her partner at home, Charlie. They are in a remote community, only accessible by dirt road, and is about 2 hours from the nearest hospital. Grace does not speak English, and Charlie is hard of hearing. Not an unusual circumstance for us to see in healthcare right now. And so I'm going to ask an overarching question to each of my panelists. The first question really around what digital health competencies do you feel are most important for the healthcare workforce to have in order to work in a technologically advanced environment? And so we'll start again from this end, Calvin.
Sure, thanks. Yeah, so so I'm an engineer by training. Like I'm in biomedical engineering now. I'm mechanical engineering by training, and definitely the biggest thing that we see as a competency for engineers working in this field really is this idea of who is the user, right? Who are the people we're developing these technologies for? And that is one of the biggest focuses of these kind of unique training programs that we run. Is the reason we need to stick these engineers and people who actually develop these technologies in the relevant settings is to get a better understanding of what these patients are, right? And what their unique needs, like the hard of hearing and even the dirt road, right? And what their kind of challenges are, and how we can address that with the technologies that we're developing, whether they be Apple Watches or whatever. I think from the other side of it, the other thing I can maybe speak to is also, if we're thinking about healthcare trying to use these technologies, probably, and this is purely anecdotal from me, is these days I think everyone, like not everyone, but many people are already using some of these consumer technologies to kind of personally monitor their health, and there's this kind of divide between actually using that for clinical purposes. And one big issue that I see is that, well, if I'm a researcher and I want to conduct a really good study, one of the first things I'm going to do is control my everything, right? And that comes to using a consistent sensor, doing something like controlling the environment and whatever, right? But because consumer technologies, there's just so many of them, we're all using different things: Fitbits, Apple Watches, Samsung phones, whatever they might be. And all of a sudden, all this information is coming in, but we don't really know, they're coming from different sources. We don't know what's wrong with these sources. And so there's a little bit of education there to talk about, well, what are the common links between all of these things that we're using? How do we actually interpret the information that's coming from all of these different sources? And should we and we should pay attention to what these sources were designed to do, because not everything is designed to, not all sensors are designed to do everything. Oftentimes, especially from healthcare enforcement, they are specifically approved to do very, very, very specific things, and that's a big one.
Thank you. I come up from it, come to health informatics from a different perspective. So certainly, I like to look at health informatics as another type of healthcare professional. It's different from the perspective that perhaps we don't have direct patient contact, but we spend a lot of time identifying what needs the users as well as other health professionals may have in terms of the systems they need to be able to provide care to, and also to do systems level analysis so we can improve the efficiency and effectiveness of the healthcare system. So, from a health informatics perspective, certainly our competencies fall into the information sciences, the management sciences, and the clinical sciences. So, we learn a little bit of everything in the context of our undergraduate and graduate programs. From a health professional perspective, because I'm also a healthcare professional, I'm a nurse. I think it's really important to recognize that there's a really changing landscape right now in terms of what's expected from healthcare professionals in terms of different types of competencies and skills around using technology, and even being able to engage with those who are selecting, procuring, implementing, customizing, and modifying those technologies. And I think one of the areas that we kind of fall into a gap is that we teach health professionals how to use certain technologies, but they become obsolete over time. And then we have health informatics professionals who are bringing in new technologies on a continuous basis. So we need that little space in between to be fitted in somehow, so we can help our health professionals to maintain their competencies and gain new ones through things like, for example, professional development in the form of maybe micro credentials, and to somehow have that work into the way we think about systems. Because certainly, based on my past experiences and working with the Association of Faculties of Medicine, Pharmacy, and also the Canadian Nursing Association, we spend a lot of time looking at what kinds of technology competencies we can gain through those programs. But people graduate, and new technologies come out. So how do we help them to be able to continue to practice effectively and to be able to support patients and each other through that entire process of providing healthcare?
I got one. Thanks, Elizabeth. So perfect segue. When you think about Grace, and I love the case study idea. We try to do this a lot with in our program. So Grace is a nurse coming into the situation, and you think about as she arrives there, what competencies does she have to be able to work with the patient, work with the family? You know, are there apps that she could be using, devices she could be using to help with the hearing, help with the language, help with the understanding the situation, as well as the data? So where is the health data for this patient and her partner? Is her partner able to access it because she is maybe not able to herself? And is the caregiver able to access that health data for the patient? So how do we help clinicians navigate those kind of environments? Also, if you think back to when Mary, I think it was, was sent home from the hospital with her in whatever state she was sent home, the discharge coordinator, the nurse, whoever it was, were they competent enough around what resources are available for the patient and their family, what support groups, what solution consumers products are available that can help them, who holds that information, and how do we make sure that the healthcare workforce is able to share that information with the patients to make the patient journey a little smoother and more seamless and accessible, as well as the clinician workload as the clinicians work in the system as well. So yeah, there's lots to think about there, just with the whole healthcare team and understanding what competencies different people need at different times.
Okay, so I'm coming here from the patient partner perspective, and I guess this might sound a little bit strange, but in terms of whether a health informatics professional or a provider professional, one of the biggest core competencies I think is very, very necessary is really good communication skills. I think from the patient partner's perspective, especially people in my participants in my research, I walk into my research space. I've changed my perspective. I walk into my research space now. I take off my hat as an expert, and I change my perspective on how I have those interactions. And so, from that perspective, you would learn that some of these patients, whether it's Fitbits that Calvin's talking about or other devices that they've used, they actually have a lot of expertise. They know a lot. And I think what's really important is if you have the right communication skills to try to listen to them, learn what they know, and build upon that. And you'd be surprised. I'll share a story with you. I worked in government for many, many years before I went back to school. I was challenged by, when I was in government, I was co-chairing a patient, how to develop a patient, one of these portals, and I didn't know how to do that. And that triggered me to go back to school. And I was looking in my PhD, how to make portals more engaging for patients. I'm no longer thinking that anymore. I don't think that, I think that patients, they're like, whether that our case study where you have someone with COPD, or whether it's someone that's living in a rural area with some sort of a disability in hearing, they have a medical issue that needs help. They're engaged. They cannot not be, because they're dealing with a medical problem. Their problem is that they don't know how to engage their providers. And so I think one of the core competencies, at least from my perspective, I'm sharing this panel, is that for people, for us, or health informatics professionals or any other healthcare provider, is to have good communication skills and learn from them and build upon that.
Thank you. Really sounds like, I mean, there's a mix of those technical skills and those non-technical skills that are really required to truly have full capacity to care in this digital world. So the next question and follow-up to that is, now that we know that our workforce needs a lot of different skill sets to really work effectively, what programs exist to help healthcare professionals build these competencies? And I'm gonna ask maybe Calvin and Glynda to answer.
Yeah, so I mean, we've been hinting at it ever so subtly this whole time, I think. So I mean, for us, again, speaking from the engineering side of things, we do try, like we've been, engineers and scrubs has been around, I think, for what, 5 to 10 years now, for quite some time, and its core mission really was to address this idea of, how do we effectively design technologies for healthcare. And I think the main premise of engineers and scrubs in particular was really focused on hospital care and how do we develop technologies that are going to go into the hospital and going to interface with the patients, but are primarily going to be used by the doctors and the nursing staff who are inside the hospitals themselves. And it's been quite successful in training up students and getting a few spin-off companies and things like that going. But recently, in recognition that remote care and after the COVID-19 pandemic, of course, too, understanding that there's probably a bigger need now for really understanding not just how do we interface these things in hospital settings, but how do we get technologies really to remote settings, rural settings, just the home in general, because wait times are so long and things like that. So that's, and fortunately, the federal government was apparently also supportive of this because they funded it. So we do have this new Care Anywhere program that's funded by the Natural Science and Engineering Research Council that is meant to really focus on this idea of remote technologies and how do we support the design of remote technologies for Care Anywhere. That's the name of the thing, if you're wondering where that comes from. And we invite patient partners to come talk to our students and tell them about what is their daily life like, how would they want to use these sensors. We talk with care professionals who go to these patients' homes and understand what the limitations there are. So we've been trying to, it's starting up, but we've been trying to really focus on at least from the engineering perspective, understanding where the barriers are, because there are sensors out there, but the truth is that not a lot of them are getting used for clinical application, and we want to know why that is.
Yeah, so to Elizabeth's point earlier, kind of filling that space where the healthcare workforce is looking to build their kind of digital health competencies is part of the intent of the program that we have at BCIT now. And similarly, we have our focus, and we always sort of ground the students back to the patients and their families, and by bringing in guest speakers and inviting patient partners to speak with the students to kind of remind them of the journey that patients have go through the system. But we also are student focused in that we're building relationships, and the whole theme of this conference is collaboration, but the building of relationships for students with not only one another, so the interdisciplinary, cross-discipline within their groups and within their cohorts, learning from one another, because as all of you know, we've got all our different health authorities, and there's lots of wonderful things going on. I heard somebody the other day talking about, instead of silos, we're talking about cylinders of excellence, and that we've all got our cylinders and we love our cylinders, but we don't like to break out of them. And so part of what we're also doing, I would say, with this program is sharing the experiences of the students that the students bring to their classmates. And then also with industry. So we have a capstone project at the end, but all along the way, we're working with students to help them to find mentors and support within industry and within the kind of different healthcare settings that they're interested in and attracted to, so that they can start to build those relationships with one another. And then we're also, you'll be pleased to know that even just from this panel, Elizabeth and I know each other from a long way back, but Calvin and Claudia, there's so much that we're doing that we can be sharing with one another, so that we're building those bridges and collaborating, so that we're getting some consistency across the healthcare workforce, which is an issue that comes up a lot from different. I get, I've had several calls from partners in the health authorities who are looking to onboard workforce employees into informatics roles, into tech roles, but developing some kind of a standard around what is required in these roles is difficult, because they're all so different. So working together to help develop some of those competencies, build on what those competencies should look like. How do we ensure that there is some sort of standard, but not that at PHSA you need one thing and then at Interior Health you need another and at Northern you need another. It's really, there should be some core competencies that we can all be working on together, so that we can build a workforce in a standardized way as much as possible, given all the backgrounds and expertise that are needed.
Thank you for that. I really loved your reference to the cylinders of excellence. We need to.
It's not mine, and I can't remember who it was. It was somebody. If anyone was at the InfoWare conference last week, you might remember who it was.
But we need to be able to infiltrate those cylinders a little bit easier. Question to now Claudia and Elizabeth. We talked a bit about what competencies we need and what programs there are to facilitate building of those competencies. Now, what would you consider gaps in the current training programs? What gaps exist in the current training programs that are available right now for healthcare professionals?
Well, I guess I'm going to go back to the not so much gaps, but what we could do more of, I guess. Definitely, and we try to do that in our curriculum as much as we can, is to try to have opportunities for at least our health informatics professionals to look at problems not within one box, that intercollaboration, team-based approaches. At least in the courses that I teach, I always look for a learning process where you're looking beyond just one way of doing things. For instance, Calvin's, and it's great because even with this panel, we've had an opportunity to interact with our own areas of expertise. And I guess when Calvin talks about his work, and I'd love to collaborate with him eventually. So some of the things that we'd like to build upon is, especially when we're talking about digital tools that eventually are used by end users, I think it's very unfortunate that the end users don't get to interact with it until the end. Really unfortunate. And especially in a world where we're in a world where we know that resources aren't distributed evenly. We know that there's pockets of populations that are not benefiting as much as other populations may be. And so what I think we could do better is to look for ways where we can incorporate different voices in the development of technologies that are intended for these populations.
For me, I actually see a bit of a gap actually taking place after every health professional graduates. And I say that from the perspective that a lot of the professional organizations for nursing, medicine, pharmacy, we develop programs or competencies and ways of transferring those competencies to our educators, where students who graduate are literate digitally. At least I'd like to think that's the case. And we've made a lot of efforts to do that. So we did some pilot work at the School of Health Information Science with medicine and nursing around bringing electronic records into the curriculum. I guess getting now 15 years ago. And I know Glynda's been doing a lot of work in that area for many, many years now. So we've been able to do that. But I think sometimes what happens is we fail to recognize that once someone's out and practicing, that we bring in new technologies, and we need to continually think of our users as needing to have updates, to have supportive environments, safe environments where they can learn how to use those new technologies. Because once you leave your undergraduate program, a lot of things change, and now the change around digital tech is very rapid. Even in a short period that at least I'd like to think I have had a short period as a career in this area, we've moved through several different cycles of different types of tech being brought in. So that's something that really needs to be addressed from a professional development perspective, and from a training perspective. So after you graduate, what happens? and how do we support you so you can be as effective as a clinician and also maybe even more effective with the supportive technologies.
Thank you for that. Open to questions in the audience at any point in time, so feel free just to put your hands up, and those online, feel free to put questions into the chat. I'm curious to just build on this conversation a little bit around that, how we're preparing the workforce to enter the workforce, but thinking about the generations that have been in the workforce for quite some time. So I'm throwing a bit of a spin at you guys, and it's not in our plan necessarily, but wondering if each of you could just speak to what you think the healthcare system can do to help bridge that quite large gap for those that have been in the system for a long time, lots of new technologies, still slow to uptake because they're maybe even in retirement consideration years. Any thoughts on that?
I have thoughts. I have lots of thoughts. I'm trying to think how to say it. I think you all need to work together. Like, there's so many wonderful things happening, and everybody's recognizing that there's a need to build these competencies. It makes me want to yawn. Just the word competencies is not a very interesting word, but it's the skills and the knowledge to be able to work in these evolving technological environments, and it's only escalating. We're adding generative AI now into the mix, and there's so much going on that we need. To your point, like, how do we get people up to speed? And I think that it has to be a collaborative effort, because we know people move from they move from different environments from one place to the other, and PHSA is doing amazing things. Providence is doing great things. Where's Corey from Fraser Health, Barb from Vancouver Coastal, amazing work that's going on. And there could be so much sharing that could be really moving this forward. So talk to each other. And we will, and for the schools to help coordinate those efforts. So we've got UVic, BCIT, Fatawu is here somewhere. Fatawu from UBC, Calvin from UBC. We can help coordinate some of those efforts because we interact with all of you. We're not because we don't have our heads down in one space. Well, we have it in our space, but we're interacting with all of you. So let us help you figure out how to bring people together. I think is one way forward.
I just wanted to add, from the patient's perspective, they haven't gone through any formal training of any sorts, but they have to learn how to manage their problems. They have to learn how to use whatever they need to manage. And, it's very interesting. They will take a technology and use it in ways that wasn't necessarily the way it was intended. They create different ways to use them. And so I'm going to take that model, maybe make that a suggestion here as a possibly something to consider, is that they do these through, whether they're online communities or anything like that. So I would think that maybe if there's any opportunities to build little pockets of communities of practice, maybe we can also learn that way.
I would actually like to see more partnerships between the university research environments and what I call industry. I think it's really important to have those research partnerships. And the reason why is oftentimes we're actually doing research in a particular area and we bring it into the classroom and it ends up showing up in the industrial world really quickly. And so one way to kind of get out ahead of this is to be able to partner with academic institutions, research organizations, to be able to learn about what they're doing and then to bring that into the industrial environment as early as possible. And I'll tell you, to give you an example, we're teaching data science competencies for healthcare in first year undergrad now. It's no longer something that is a graduate level competency. And they're coming. And we also need you to tell us what kinds of things you think are important so we can do research in those areas so we can help the healthcare system. So really important from that perspective. Work with us. After all, you know, every single technology you're working with probably started off in someone's lab with a group of graduate students thinking, how can we solve this problem, right? So, and I'm here to say we want to work with you so we can make your lives easier and also get these technologies out so we can help more patients and citizens in health from a healthcare perspective.
Well, I'll start by saying something that you all know, and education is now about teaching people to learn. The people who are studying now need to know how to learn the new stuff. And then I wonder about, because of the amount of equipment that a province like British Columbia buys, if there can't be pressure to make. Yeah, I'm looking at you, Mr. Engineer. Can you pressure the manufacturers to make appliances, for lack of a better word, that run on our pretty powerful laptops and home computers? And maybe there's a next level up of powerful computers that we see in the hospitals. And is it possible to make standardized platforms and get into the idea of repairable things? I've seen too much of some group of really smart people made a machine, and it was a great machine, and 5 years later they've moved on and the company's out of business. Now you can't fix it.
Yeah, I think that gets to a point that somebody already made up here that wasn't me, which was good. I think it was to my left here, but definitely this idea that tech moves so fast now, and like tomorrow, like between the last time we met as a panel to discuss what we're going to talk about and today, you know, Apple Watch and Massimo, if you haven't heard that whole thing about their, you know, their heart rate monitors, and I don't know what's going to happen, right? And apparently Apple, unless they figure that out, won't be able to sell their watches anymore, and who knows what's going to happen there. But I think, you know, from my perspective, I think this comes down to, I think there are two things. One is seamless transition of technology into our current healthcare system, and how do we, like right now, all of these things come on the line and they're all in their own little bubbles. Apple has its own little metric thing that tells you you're sleeping 8 hours a day or whatever, and it's got its own little user interface for it. Fitbit's got its own little user interface that's maybe not how much sleep you get, but what is your sleep, you know, your time to sleep or whatever, like some other metric, right? And everyone's kind of in their own little bubble, giving you their own little metrics, and we have no idea what to do with it. And of course, on the clinical side, right, we do run a lot of these kinds of measurements already. Like we do run sleep studies where we collect standardized sleep information. And I think there needs to be a way to seamlessly translate technologies, whatever they might be, wherever they might come from. The next one that comes down the line needs to come and say, I'm going to give you this information in the standard clinical way, and this hopefully addresses some of the learning aspects of it too. And I know some folks at UBC are doing research like this about translation. Like I'm looking at Matthias, I think this is an area that you work in particular. And the other side of it is transparency, I think. Like I do think, you know, I agree that we need to be working a lot with industry. And I think one of the things we should be pushing for a lot is transparency, better transparency about where the data comes from, what is the accuracy of this data. And from my perspective, like, you know, a device can come to me tomorrow and say, we have 100% accuracy in detecting, I don't know, sleep apnea or something like that. And I'd say, great, right? Show me the data. Where is this coming from? The most important thing for a lot of these technologies is, where did you test this? How did you test this? Because it probably is 100%, but only in a very specific application, right? And we need to know what that looks like.
And who you tested it.
Yeah, and who you tested it on, right? All of this thing is important. And, you know, it's fantastic. I don't doubt you have a fantastic sensor, but we need this information so we know what to do with that kind of technology and how to incorporate it into healthcare settings to make sure that the right people are using the right devices and are getting the right information. So I do think there's a little bit there that, you know, to me, those are the two things, right? Transparency and translation, like in seamless translation.
Go ahead, Chris.
Yeah, two comments on the patient side and such a scenario. it's really important to find out what's the need to have and do and what's the nice to have and do. And then once you've really identified that, and then how are you actually going to get that from a data point of view and a technical point of view, then we often look to the patient support network. Albeit in this scenario, maybe there's a neighbor, or who knows, maybe there is a relative close by. I mean, I know that I have had my kids educate me for the new things. So I think thinking in that way, it's about the support around that person, what they actually need to do, and trying to build that in as you're working forward. And that's sort of one of the messages you can get across when you're training, that sort of thing. On the health professional side, my reflection there is particularly for the people that have been out in practice for a long time, and which is challenging. So what is their incentive in order to actually want to engage in further, skill building, shall we say? And a couple of them are easy to do, brief, online, sort of repeated, sort of incremental skill building that they can do a half hour at night or something like that. Because those are the things people are a little more willing to do. But I think that, and this requires a fair amount of collaboration. For nursing, there's different there's different pay grades, right? And so if they actually get a certification, work towards that, can they actually move up a pay grade? So I think that would require, of course, is union stuff, collective agreements, blah, blah, blah. So I'm not saying it'll be easy, but you actually have to look at what are people's incentives to be able to do those things. And those are two of the things that sort of quickly come to mind.
Great reflection. I'm wondering, even Elizabeth or Glynda, just to talk about or whoever, just to think about that concept of micro-credentialing and how that might fit into all of this building of capacity.
I have a question back for you. So yes, so the idea of micro-credentials, is there for patients and families, is there something there around kind of that digital health literacy that might be, we can do some sharing with healthcare professionals, like across? Would there be if we were looking at micro-credentials, would it be patient caregiver focused or together with healthcare professionals? Like, do you see it as the type of micro-credential that would be or a kind of collaborative cross-learning situation, or more focused on one group or the other?
Well,
If that was going to be
I
something.
think if you want to start going down that route, you deal with the health professionals been out in practice for a while. I think you really have to, through research and patient engagement and all that kind of thing, see whether there are opportunities for, and I think part of the learning that you build in is how does that reflect back to actually case scenarios of supporting people and that sort of thing. On the learning side for patients and people with lived experience, I'm not sure whether it's micro-credentialing in that sense of it. It's skill building, right? So I think sort of working together to try and achieve that, I think that's a future thing. What I'm saying is micro-credentialing now to sort of upskill people that have been in practice for a while, and those incentives I talked about. As far as sort of patients and that sort of thing, I'm trying to think. I don't know how feasible that would be. I guess, are you saying like a course for patients who are interested in doing that, where they could actually train with professionals as well? I don't know.
So there are models where there are where there's patient experts, right? Like the UK has a model, right? Is that what you're thinking?
I think where I'm going with this is that I've had patient partners approach me to say we were looking for something around digital health literacy to sort of be able to work with the providers in the healthcare systems that are advancing. So what would that look like?
So back to my problem where I think a lot of the patient partners are looking for ways to engage their provider. Yeah. So the word patient engagement sometimes is really provider engagement that they're looking for. So maybe you're saying some sort of micro credentials so that they have the literacy so that they're able to make those negotiations and with their providers the other way.
I think it's more knowing that the healthcare providers do have those adequate skills. And if they are able to articulate and communicate to me as a patient what they're trying to do and how I might participate in that, then I would ask myself, well, if I'm not able to do that yet, how can I actually achieve that? Because I want that productive relationship. So I think that's more the logic of how I'd follow along.
I think there's some really good ideas there to explore further, and it sounds like we'll talk more.
Yes, we'll talk more.
From a comment perspective, I think it's important to remember that every healthcare professional cares about patients and they want to maintain their knowledge base. And if you can provide professional development that's meaningful and involves technology that would help a patient, I think you'd have people there. So it's for me, I think it's just packaging in some respects, and understanding that health professionals want to learn new methods to make their patients feel better and be better. So micro credential, professional development.
Yeah.
I don't see the difference. It's to me, it's about what are we providing then at them in that educational unit so it's meaningful.
And virtual health is a good example, right? Once you got experience with it, some people wanted to do that as long as they felt comfortable with that.
So I'll suggest something a little out of there and a little fun. I mean, I think remote, like these kinds of remote technologies in particular, which is where I work, I think there's a unique opportunity there, especially in healthcare, because, you know, now you're no longer in the hospital, right? We don't have to build competencies for things that we have very few of and things like that. I mean, can we just give a bunch of smartwatches and remote technologies to our healthcare professionals and get them to use it, right? And understand what it can give them. Like, I don't know. For me, the best way to learn is to actually use and to actually do. And I wonder if there's an opportunity there, right? To just say, hey, try it, right? Try it out, see what happens. You might hate it, but now you'll know why you hate it, right? And then you can talk about it to your patients, talk about it to us so we can do it better and things like that, and etc. But anyways, that's just me.
Well, they are giving more iPads out in the community, so for health professionals.
Thank you for that. We are out of time for questions. I just got the 0 minutes left, but just want to a round of applause for our fantastic panel, the wealth of knowledge that sits at the front of the room.